Everyone right to go? All good? Thanks so much for joining us for the daily update. Firstly, there are 1,660 cases of coronavirus in Victoria. That is 127 more than yesterday. The breakdown of those, and of course Brett can add to these numbers with any insights. 34 of those 127 are connected to known and contained outbreaks. 40 are the product of routine testing. 53 are under investigation by our public health team, and obviously the details around those will either be covered in the Chief Health Officer's media release and statement later today, and or reports that we'll provide to you in the coming days. There are 645 active cases of coronavirus across the state. On testing, can I indicate to you that despite the inclement weather yesterday, very challenging day normally to keep testing numbers up, but we have achieved 24,528 tests. That, I think, is surely across the course of a weekend a record in terms of the amount of testing we're doing. And again, we thank each and every Victorian who has come forward to a retail site, to a GP clinic, to a drive-through site, all those who have agreed to a test when somebody has knocked on their door and offered them one. As I've said many times, and I'll keep saying it because it is central, that data, those test results are critically important in our collective fight against this virus. And again, I'm so proud and grateful to everybody who is doing those tests, both the people who are taking them and those who are consenting to being part of that testing process. That means in total we have completed some 952,699 tests. That is without any doubt one of the highest rates of testing per 100,000 anywhere in the world. We have 31 Victorians in hospital and 5 of those are in intensive care. Sadly, it is my duty to inform you that a man in his 90s has passed away overnight. He was in the care of one of our hospitals. We send our condolences and our best wishes to his family and loved ones, his friends. This will be a very difficult day for them, and we send our sympathies to each and every person affected by that tragedy. Out of respect for the family, I'll provide no further details as to that person's identity or any further details about that case. If that changes over time, then of course we will, but at this stage we're not in a position to shed any further light on the circumstances of that individual. Now, I've got a couple of other things I want to take you through. Firstly, from 11:59 p.m. midnight tomorrow night, the border with New South Wales will be closed. That is the result of a phone hookup between the Prime Minister and the Premier of New South Wales and myself just an hour or so ago, where we have all of us agreed that the best thing to do is to close the border. It'll be enforced, that closure will be enforced on the New South Wales side, so as not to be a drain on resources that are very much focused on fighting the virus right now across our state. And I'm very grateful to the Premier of New South Wales for her support in giving effect to that. This is one of those precautionary measures. It's one of those things that I think will help us in broader terms contain the spread of the virus. What it means, for instance, is many staff who are currently being employed or being deployed to take temperatures, to do all sorts of coordination work, whether it be at our airports or at train stations, for instance, will no longer have to do that work and can potentially be redeployed into other, arguably much more important roles. I apologise for any inconvenience that will cause people who've got unavoidable travel to New South Wales. There will be a permit system, and there'll be further detailed arrangements will be announced by the Premier of New South Wales a bit later on today. But there will be a facility for people who live on those border communities to be able to travel to and from for the purposes of work, the purposes of the sort of essential health services that they might need. I'll give you one example. The Albury Hospital, which is actually run by us, is of course on the other side of the border. There are some services that can be accessed in Wodonga. There are others that can only be accessed in Albury. There'll be specific arrangements put in place to make sure that people can get, in that example, the health care that they need. I'll leave it to Premier Berejiklian to make further announcements, I think, in the next couple of hours about some of the details of how that arrangement will be rolled out. But that is the product of a joint decision and an agreement between the Prime Minister, myself and the Premier of New South Wales, one that I think is the smart call, the right call at this time, given the very significant challenges we face in containing this virus. Beyond that, I just want to go directly to issues of support and care for those 3,000 residents who are in the 9 public housing towers that are the subject of an unprecedented and very challenging, hard lockdown. It is very important that we make sure that we contain the virus and that we can control the movement of everybody in those towers unless and until they are tested. That process is well underway, and it's my expectation that each and every one of those residents gets tested, and that the sooner that's done, the sooner we have those tests taken and the results back from the laboratory, the sooner we can assess the results and then make judgments about what rules, what sort of restrictions, what treatments need to be applied to those who have the virus, who reside in those towers, and those who do not. Staying inside your flat, inside your unit, is the safest and best thing to do. It's not pleasant. I know it's challenging. It's very, very challenging. But it is far preferable to seeing vast numbers of people with underlying health conditions infected with this virus, spreading it between each other, and the inevitable tragic outcomes that would come from that. I said yesterday, and indeed the day before when we announced these arrangements, that it would be a massive task, and it is fair to say that no element of this is easy. I want to reassure everyone in those towers, their family beyond those 9 towers, and indeed every single Victorian, that there are literally hundreds and thousands of people working, from police to social workers to nurses and doctors, all the way through to people working in our supermarkets, people working in commercial kitchens. There is many, many hundreds, and indeed it runs into the thousands of people, and they are all doing their absolute best. It doesn't make it any easier. It is very challenging to stand up something as quickly as this, but it's based on the best public health advice. It is the only option that the government had to do that important work of containing the spread. Every single person, and there are many of them, are out there doing the very, very best that they can. And we'll continue to work hard every hour of every day over this 5-day period to get to every resident the support that they need and to get every resident tested. That's the real key to giving us options and potentially having a different set of rules once those 5 days pass. Now, if I can just give you just a sense of how big a task this is, just a few examples of some of the work that has gone on by those hundreds and thousands of people. And just before I do that, I should say how impressed and how grateful I am for the big-hearted way in which so many Victorian companies, Victorian families have reached out with that hand of friendship to provide support. And there are many different partnerships that are being managed and worked on between officials of the government and other partners to try and make sure that we make the best use of all the different donations, all the different offers of practical support. That is a very impressive thing, and I'm very grateful to everybody who has reached out to extend that hand of friendship to their fellow Victorians who are in unprecedented lockdown. Just to give you a sense of the task and the work that has been done these last 36 hours or so, 3,000 meals, this is just Food Bank for instance, 3,000 meals and 500 hampers have been distributed to residents. They were distributed yesterday. Of course, I want to thank all of those partners for the work that they're doing. In more detail, Food Bank have provided 1,000 hampers containing essential food staples like cereal, long-life milk, sugar, pasta, canned vegetables. 350. This is just Food Bank. 350 personal care packs, including soap, deodorant, toothpaste, nappies and baby formula. Every single household this morning, just by way of example, received a bread and milk delivery at their door. Fair Share, another fantastic charitable group that prepare meals for so many people across the state. They have provided 3,000 pre-prepared meals and 4,500 pastries. Victorian Trades Hall, in partnership with an organisation called Moving Feast, have delivered several thousand several thousand halal meals. We know this is a particularly culturally and linguistically diverse group of people, and making sure that we've not just got quantities of food, but the appropriate food is very important as well. Coles, I want to give them a shout out. That's not just to single them out. I'm sure other grocers are doing similar things, but the one that I am briefed on is maybe that's encouragement to all of them to match Coles. Coles have donated 7 pallets of essential personal care items. We know our supermarkets, whether it's Coles, Woolworths, Aldi, IGA, there are so many that have done so much, from stacking shelves, putting in extra efforts, as well as these very generous donations to provide support to the most vulnerable. And I thank the whole supermarket sector for the work that they have done. Beyond that, there are a whole range of other personalised requests and deliveries that are being facilitated by staff, including from local government, from the Department of Health and Human Services. Obviously, VicPol are there in strength. That's about securing the site and making sure that it is, in fact, a hard lockdown. My list goes on and on. The final 3 points I'll make: there is substantial mental health support available. There is substantial pharmacotherapy support for those who need those services. And the final example I'll use is that 400 packages for kids in the towers. And I think there's been some coverage of this, everything from crayons, Lego and puzzle books, all of those sorts of things that are critically important to make sure that our kids have got something to do as well in unprecedented circumstances. This is a massive task. And the message to everybody in the towers, and indeed all our partners and everybody across the state, those staff, thousands of them, are doing the very, very best they can, and they will continue to do everything they can to support those who are impacted by this lockdown. Just finally, before I ask Richard to speak, to add anything he wants to add to this, I can confirm that within those numbers I reported before, the 127, 53 cases, that is 16 more today, taking it to a total of 53 cases have been detected in those towers. We expect that number to continue to grow. If you know it's in there and you are literally going to test everybody, then you will find more cases. That's the strategy. That's what we want to be able to achieve. Then we can provide care and support and the appropriate framework around anybody who tests positive, and indeed end the lockdown for those who are not positive sooner rather than later. I think that probably covers off most of the points that I wanted to make. I'll now ask Richard just to add in any other commentary, particularly in his capacity as the Housing Minister, a neighbour, a local resident, and then we're happy to take any questions you have.
So thanks very much, Premier. These have obviously been very challenging times to stand up this response. It's quite a unique situation that we find ourselves in, where we are seeking to address really very significant challenges that we've got in this high-density housing. And as we've seen from the numbers that the Premier has talked about today, we've had an increase again in the number of infections in the towers, and that's why all of the hard lockdown that has been put in place is just so important to manage this virus, because it is so virulent. I can indicate that we, as the Premier has already outlined, that we have put an enormous amount of work into ensuring that we get to all of our residents, all 3,000 of them. We have made contact already with more than 900 who have reached out through the helpline seeking various levels of support, whether it be around housing or medical support and the like. And we are also reaching in to those tenants as well through our call centre network. So it's a two-way operation here. We continue, of course, to ensure that we have at the ground floor of all of the towers all of the appropriate supports that the Premier has already indicated, whether it's alcohol and drug support, whether it's mental health support, all medical support, of course, is there as well. And today we will be, of course, ramping up the testing regime. As of yesterday, we had approximately 400 tests were conducted in the towers yesterday, and that will be significantly ramped up today. And as the Premier has indicated, we want to ensure that everybody living in those towers is in fact tested going forward. I know that there's been some commentary about perhaps people who have not necessarily received the level of support that they would have liked, but I just want to assure all of our residents that we are doing absolutely everything that we can to both reach out and support people in this really difficult time at the moment. I think more broadly, as the Premier has indicated, as somebody who is associated, well, I live next door, literally, to the North Melbourne estate. I know how difficult it has been for my neighbours who are doing. This is tough. This is a very, very difficult time. But I can assure all of the residents in those 9 tower blocks that we are with them, we'll stick with them, and we will support them right through this incredibly difficult time.
Very good. We're happy to take any questions you have.
Can I just clarify on those numbers?
Rachel.
The testing numbers, you said 53 cases in the towers. And
Correct.
You said that was 16 more than yesterday. We had 47 yesterday, so that's wasn't enough.
Brett can speak to that. Do you want to push on with me first?
Can Brett also, sorry.
Sure, Brett can. No, Brett can do it. It's fine.
Yeah, but also takes to the other outbreaks.
Yeah, so the 53 total that we've now got for the towers does include 16 new cases as of today, but there are an additional 10 that were in earlier numbers that are now linked to those towers. So it's an increase of 26, essentially a doubling of the numbers from yesterday, and really not unexpected, and is exactly the reason why these towers are in a hard lockdown and why we're doing extensive testing across all of them. For additional outbreak numbers, of the 18 other new cases linked to outbreaks, 1 new case is linked to the Truganina family outbreak, a close contact of a known case. There are 14 new cases linked to the Altaqua College outbreak, all previously identified school contacts. Essentially all of those school teachers and children are in a quarantine. So the total there brings it to 77. There are 2 new cases linked to the Patterson Lakes Listerfield family outbreak, and there's 1 new case linked to Camberwell Grammar outbreak, taking that total to 4.
The majority of these cases, if you're keeping up with the testing, I know a lot of investigation, those testing happen in the broader northwest in these lockdowns, so those are raised in other parts.
They're very much in that northwest corridor, so they're very much focused in the hot zone, if you like. But there is a significant number that are in the adjacent postcodes. So it's not just in those restricted postcodes, there's significant spillover. And so to use the bushfire analogy, there are literally spot fires adjacent to those restricted postcodes. But people are absolutely being engaged in those areas. So there's lots of door knocking, there's lots of testing that's occurring, and so we're picking up the cases in those adjacent postcodes, but they're not only in those restricted ones.
So Brett, it's now time, given that, to expand the areas that are under lockdown, and then you're seeing these spot fires.
As I say, we're reviewing this on a daily basis. We do need to see whether the numbers in those postcodes, adjacent postcodes as well as the restricted postcodes, are stabilising. Yeah, you're right. We're needing to watch those adjacent postcodes especially to see how to respond.
We
The
had
fact you're
60 active.
the fact you're closing the border, does that signify that this has got out of the hot zones and then the rest of the state is being locked down?
No, Rich, I think that it's simply a precautionary principle being applied. It makes sense, frankly, at this time. No, and I think you'll note that I've made no comment about border closures right throughout this. I spoke with the Prime Minister, I spoke with Gladys. We agreed that this is the best thing to do at this time, out of a sense of caution. Beyond that, if you think about the resources that are needed from a Victorian point of view to be monitoring and checking people just from those hot zones, this is a much more logical way of doing it. No one enjoys doing it, but it is, I think, the right step to take at this point. That won't be a feature that goes on any longer than it needs to, and I'm grateful that it'll be enforced on the New South Wales side of the border, so that it's not a resource burden for us. We've got quite a bit to go on with at the moment, and that's where our focus and energies have been focused and will remain focused.
Premier, on that border closure,
Everybody will get a go. We've not walked out of one of these without answering every question for a long time now, so that won't change today. So
on that border closure, you say it was a joint decision.
It was.
You suggested it, correct, in New South Wales, Premier, or you-
I had a conversation with the Prime Minister. I've had conversations with Gladys. We all three of us agreed that this was the right step to
It's all
take.
put in your minds at the same time.
Well, I'm not going to get into silly games about who was the first person to mention the word border. It was a mature, a proper, and completely necessary decision, and the conversation reflected that. I'm not going to get into trying to dissect the conversation as to who rang who and who spoke first. There's been lots of conversations between officers. There's been lots of conversations between leaders, and there was a three-way conversation an hour or so ago, and we all agreed that this was the right step to take. And as for the practicalities and the delivery of this, Gladys will be doing a press conference a bit later on this morning, and we'll be able to speak to all of those matters.
Confirm whether it was advice from the New South Wales Chief Health Officer which opted this, and that their health advice changed on the border as to
If you would have to speak to the Premier of New South Wales about advice from her Chief Health Officer. All th-
advice from our Chief Health Officer on the border.
Well, this is about limiting movement outside Victoria, and the Victorian Chief Health Officer is responsible for public health within Victoria. So this is very much a decision that is made by myself, the Prime Minister and the Premier of New South Wales. I apologise for any inconvenience that it will cause those who would otherwise have travelled, but this is the right approach to take at this time, given the still unacceptably high numbers of cases, and the fact that our focus should really be exclusively on testing and then finding the close contacts of those positive cases and doing everything we can to limit the spread of this virus.
Were you given any option? Did the New South Wales Premier say
I'd-
you could do it anyway?
No, there's nothing more or less to this than what I have basically announced. All three of us agreed that this was the appropriate step to take right now. There's no more intrigue to it than that. It wasn't a matter of anything other than a unified and joint position to take this step. That's why I'm speaking to it now. Gladys will speak to it later. National Cabinet has been informed by the PM about this, and no doubt the Prime Minister will speak about this at some point also. There's no more intrigue to it than that.
Go back to Gladys' stuff and just get you to talk us through the 127, that's a new record number of cases. What's your thinking about how this is going to progress?
Clearly 127 is a big number, and nobody wants to see it, but we do have a very clear picture on a daily basis with the record test numbers that we're doing. So we do have a picture of how it's trending, and we do know increasingly that we're seeing them in outbreaks. And it's not to dismiss outbreaks, because every outbreak leads to cases that require hospitalisation, some of whom go to ICU, and it puts people's lives at risk. But we know where they occur, and we know how to manage and control them. Nonetheless, the community cases have remained relatively low. I think there are 13 new linked today, but it's the overall numbers that we need to keep an eye on. It's been an up and down last few days in terms of numbers. We need to see those trends over a longer period of time. We need to go into the detailed epidemiological review, postcode by postcode, the heat maps that we look at every day in terms of where cases are occurring and how that's shifting over time. So it's a concerning number, no doubt, but we're continuing to look at those numbers over time to best inform decisions.
We've got much higher levels of community transmission than we had during the first wave, and we had a fully statewide lockdown at that point. At what point do you reach a threshold where you have to lock down the state again?
Well, look, I think that's all for discussion. We're not excluding that possibility. We've always flagged that we've got these two tools, the testing and tracing tool and the physical distancing tool. We've worked extremely hard to get the word out because we know what works around physical distancing, limiting your contacts with other people and stepping up for testing if you've got any symptoms whatsoever. but we need to form a view over coming days as to whether that's a sufficient suppression of transmission.
Do you know how the virus got into the towers yet? Do you have like the design pieces of how the virus got in?
We know that it will relate to community spread in the vicinity. So, you know, someone has picked it up who's a resident of a tower who's been in interaction with somebody else in the local area.
Haven't brought it home from work or anything like that?
It'll be very difficult to know with such a large number of cases who might have been the very first case. Sometimes the first case that's notified to us is not the first case in an outbreak. Sometimes the first person to develop symptoms is not the first person who's been exposed. So it is tricky in that regard.
Are you disappointed that 400 tests, given you completely locked down these towers? Are you disappointed by that high number, given there's nowhere else these people can go?
No, I think there have been operational priorities that have been put in place first, and that's food and welfare checks and psychological and other support. We'll ramp up the testing. That'll get done over the next 5 days, and I'll be very happy that we've got a good picture of exactly how much transmission might have occurred there. Sorry, Andrew? Not that I'm aware of. Not that I'm aware of, but I can get back to you.
Or any other public housing that's outside?
No, not that I'm aware of either.
We've got 60 active cases as of yesterday in Wyndham. That LGA doesn't have a single postcode that's locked down. What's going on there? And it's the LGA in Victoria with the second highest number of cases.
Yeah, so LGAs are one of the filters that we put over decision making about a restricted postcode, but we also look at the rates within those postcodes depending on the population. It's a big population as a local government area, but they're all for consideration on a daily basis, and we will take appropriate measures if they reach thresholds that we've laid out.
Is it inevitable there will be more lockdowns in other postcodes? Is it inevitable now?
I don't regard anything as inevitable, but I also regard as everything as being available to us as required. Again, we know what works. It worked through March and April, and those measures are the physical distancing that we can all do and the isolation and quarantine of cases. If that can be done through everyone doing the right thing, both within the restricted postcodes under public health directions or more broadly through awareness and motivation and being in it together, then that would be overwhelmingly the preferable thing to occur. But if there are public health directions that need to overlay that in order to make sure that absolutely transmission is being suppressed, then yes, that's an available tool.
What are the testing options for people who don't live in hotspot areas, and is there a bit of a lag in terms of getting those results back to them?
There's a small lag. Given the volume of testing, I think it's a very reasonable one. We do want people to go to whatever testing stations that they can find. There's over 100 in Victoria. There are new ones popping up every day. I don't think there are any constraints to people being able to find a place where they can test, and I absolutely encourage them with symptoms, mild or otherwise, to step up and get tested. No, I don't think so. It might be. As I've said, there's a pilot that includes the saliva test. We know that it can be a test that's more palatable, especially for children, and it's requiring validation over time as it goes. It doesn't have quite the sensitivity of the nasopharyngeal or back of the throat and nose testing, but if it can be done in others who might not normally test, then we'll consider it, absolutely.
Are you aware of any refusals and testing in the tower?
No, I'm not aware of any. As I say, Minister Wynn's spoken of the 400 or 500 tests that have been done to date. There may be refusals. I think we'll get a very, very, very good picture of exactly what's happening in the towers, and a few refusals won't really alter that picture. But we do want absolutely everyone to say yes if the door is knocked on.
Brett, if social housing towers have vertical cruise ships, do you think we need to change how we manage it in future? Do you plan to change how things are managed in those towers moving forward?
Yeah, I think we'll have to get all the lessons of this as we have from cruise ships, and one of those things is about everything that you do in the prevention space to make sure that there's awareness amongst all of the residents about symptoms and stepping forward for testing. All of the things that we know work from a prevention point of view, the social distancing that can be done to the fullest extent possible, the hand hygiene, the cough etiquette. But there are structural issues in the same way that cruise ships have them, in the same way that aged care facilities have them, that make it more vulnerable. And again, it's not about the individuals who are in these settings, although they have those vulnerabilities to more severe illness. It's about the structural issues that make this a challenging situation in terms of the outbreak potential. And having the shared laundry, having tight spaces, lift wells, stairwells and corridors and foyers is the challenge here as well. So they're not easy solutions.
If that's the case, did you raise it with the government before that we needed to be on high alert for these vertical cruise ships?
Well, in all of the discussions we've had right through the last 5 months, all of the relevant departments have understood the potential for transmission and what's required from a physical distancing point of view, and all of the other measures that need to take place in terms of awareness. So that's not new. But it's a difficult exercise to engage absolutely everyone across all settings. But WorkSafe have had that awareness, and there's been representation at the State Control Centre and of course across Crisis Council of Cabinet in understanding those challenges.
Are you aware of the case involving the Glen Shopping Centre and Waverley?
No, I'm not.
There's a new outlet that had a case associated that was allowed to stay open, but only yesterday and this morning it's gone closed.
Right.
You're not aware of that?
No, I haven't got the details of that. There are settings where someone will have been infectious at work, but haven't necessarily acquired it at work. So their close contacts get quarantined, but the setting can continue to operate. When there's any view that they might have picked it up at work and there might be other workers who have passed it on to them, then we need to shut a place in order to understand exactly how transmissions occurred. But someone in a workplace doesn't necessarily mean you shut that workplace. You just need to make sure that their close contacts are in quarantine.
Premier, just on the lockdown in those towers, the detention order is 14 days. Will this extend it on 5 days later?
Well, as I said on Saturday, the order is made for 14 days, but it can be rescinded earlier than that. Well, my expectation is we get everybody tested. That's the first thing. I simply can't answer your question until we've got everyone tested, and that is the clearest appeal that I can make to every single resident in those towers. When you are invited to take a test, whatever form that invitation takes, your only answer should be yes. Because if once all 3,000 residents are tested, we will have more options based on data, and hopefully that means we can have a different set of rules that are not quite so hard in terms of that very hard lockdown that we've put in place on health advice to protect those residents, many of whom are amongst the most vulnerable in our Victorian community, and indeed by extension the broader public health.
Premier, the Trades Association was caught by surprise on Saturday about this announcement, and they've been saying that they've had to drag police from all across the state to resource that effort at North Melbourne and Kensington. Will you need to get ADF assistance for this operation? I know that you've got more ADF
We do.
assistance coming.
We do have more ADF assistance coming from a logistics point of view, State Control Centre. There are a couple of hundred ADF staff that are either here now or are on the way from a clinical point of view, for instance, taking over some of the mass testing sites that then allows some Victorian staff to go off and do other things, whether it be testing in these high-rise towers or other settings where people can't leave their home. Every time I've asked for anything from the Prime Minister, the answer's been yes. I've had a further conversation with him about that today. We'll be talking again later today about some additional ADF support, some additional AFP support potentially, Commonwealth Public Servant support. The list goes on and on. There is at no point have I been advised from any of my officials, public health or otherwise, to make a request where that request has not then been made and receive favourable consideration from the Commonwealth, and I'm very grateful to the Prime Minister for that. Beyond that, just on interstate colleagues and the notion of testing capacity, I haven't got yesterday's numbers in front of me, as in Saturday's numbers, but we must be 50,000 or so close to it that it's essentially a 50,000 weekend. and if you go back to Friday, it's a 75,000 3-day period. We have never done that much testing in that shorter period of time, even with inclement weather. So I do thank everyone who came forward and got tested, to all the people involved in that process, taking the tests, processing the tests. In our conversation this morning, Gladys Berejiklian has agreed if they can do some more testing in New South Wales, they're doing about 2,000 tests for us per day. We think there might be an opportunity for them to do a little more. And again, I'm very grateful that everybody is sharing resources, working together, fully acknowledging that this is a problem not just in Victoria, but a problem across the nation if we don't see that stability come to these numbers and then those numbers be driven back down to manageable levels.
But the police association says it can't actually maintain that effort at the number of police.
Well, I'll leave it to, with the greatest of respect to the TPA, I'll leave it to the Chief Commissioner to speak on those issues. I don't determine where police resources go. I just make sure they've got more recruits than they've ever had, Nick, and that's what I've done. How they're deployed, that is a matter for the Chief Commissioner. He's confident, I know he's confident, that he is able to continue doing the outstanding work that's being done by police members, whether they be sworn officers or PSOs, in and around those 9 towers. If that were to change, he'd speak to me. He certainly hasn't. He's very confident that he can continue to do what has to be done. And beyond that, I'd leave it to the Chief Commissioner to speak to any and all of those issues.
Premier, what's the reluctance of the government to have ADF personnel?
There is no reluctance, and whilst that point is made from time to time, those opinions are put as fact. I don't know how many times I've said it, but I'll say it again. Whenever I have needed anything from the Prime Minister, the answer is yes. I've got no issues with anybody from another state, anybody from another agency, anybody from another level of government. We are all working together. Local councils, the state government, all of its agencies, some volunteer groups, a whole range of different partners, and indeed we have ADF and have had ADF support in the State Control Centre throughout, just as we did during bushfires. So again, I can't determine the questions you ask me, but please don't in any way interpret any reticence on the part of anybody in my team to get the job done. And any and all personnel will be used. I am absolutely unconcerned. I could not care what uniform people are wearing. We have got to get this done, and we will.
Premier, we've got 400 tests done today. We're on day 3. There's, what, 2,000, more than 2,000 tests to come. How can this realistically end within 5 days of lockdown to then get the results back?
Well, a couple of points. One, you'll see many more than that number of tests done today. There's always that the early stages are always slower than once you get up to full speed. What's more, there is dedicated laboratory capacity to give these tests the priority that they should be given the extreme lockdown that these residents are in. That's not to say that others will wait much longer, but frankly, no other test that's being processed comes from a community, an entire community of 3,000 people who cannot leave their home. So that dedicated lab capacity is really important. We will get this done, and at the end of the 5 days, we'll be able to then look at the data and make judgments about what the best way forward is.
Premier, it's my understanding that Labor used its numbers on Public Accounts and Estimates Committee this morning to veto that committee looking at the government handling the coronavirus pandemic until August. Why are you voting?
I cannot provide you with any update as to the business of the Public Accounts and Estimates Committee today. I am neither a member of the Public Accounts and Estimates Committee, nor have I been briefed or played any role in the deliberations of that parliamentary committee.
Your MPs nevertheless blocked it every crossbench.
Well, I've just answered your question, Rachel. I've not had a conversation with any of those. I've had a fair bit to get on with today. That committee is a committee of the Parliament and constituted by a vote of the Parliament. And we will, if you want to know what they've done, then you would need to speak with them, because I certainly haven't been. I've got lots of other things to do.
You previously said that that
This
committee
weekend, will that go ahead?
Pardon, sorry?
Judy's Sport is resumed this weekend.
We'll have further announcements to make about all of those elements of the current framework that fall due, if you like, over coming days. But today's not the day for us to do that.
At the moment, it's still going.
Well, when
People are anxious about whether
I'm certain they are, and when we're in a position to provide you with further clarity about that, we will. Schools are monitored, as I indicated last week. We're in school holidays. The position of schools within those lockdown postcodes, that's being monitored, that's being dealt with off the data, Lundy, and when we've got more to say about that, we will. We've always made it very clear that we would give parents as much notice, and teachers and staff, students as much notice as we possibly could, and our position hasn't changed on that.
Premier, residents in the building were saying that the Deputy Chief Medical Officer's order that says that the 14 days is being handed out to them. I know you said that that's just a legal thing, it has to be 14 days, but do you think that was appropriate to be handing out that document that uses terms like detention or refers to 14 days?
Well, it's a legal process, and in order to, well, look, I'll put it to you this way. From time to time, there will be steps that you have to take that may not necessarily be ideal, but people have a right under an Act of the Victorian Parliament to know exactly what their status at law is, and I would hope that didn't add to any distress. That's why we're all working as hard as we possibly can. That's why we're all making sure that we provide the support that is necessary, and it's why I want to reassure every single resident in those towers that every one of the hundreds and hundreds of staff and volunteers and partners is doing the very best they can. This is not easy. They'll continue to do their very best, and I'm confident that that will serve the needs of these residents well.
Can you confirm that stood down airline staff have been approached to step in?
The Corrections Commissioner and Corrections Victoria, who have control from a management supervision and overall chain of command control over our hotel quarantine, is very pleased that we have sought to engage a number of cabin crew who are currently stood down from Qantas. There's been a bit of commentary about this today. Let's be clear. There are very few groups of people who take safety more seriously and know and understand safety protocols and dynamic environments and the need to always go by the book than those who work in our aviation sector. The Corrections Commissioner is completely comfortable and pleased to think that people with that skill set will join the hotel quarantine team. I want to be very clear, however, on one point. These will not be contractual arrangements. These will not be subcontractual arrangements. Any and all stood down cabin crew who come with that specialist skill set to work in hotel quarantine will be employees of the Department of Justice and Community Safety, and they will be directly accountable and will report directly and be under the direct supervision and management of Corrections Victoria and under the leadership of the Corrections Commissioner, who is very pleased to think that these unique skills can become part of her team to deal with the challenges of hotel quarantine.
In terms of the ADF that you announced today, how many new ADF personnel are you expecting?
We're still working that through. I think there will be a relatively small number that will go into the State Control Centre. They're people who bring really specialist skills, and they're absolutely invaluable, and we've had them there during fires, we've had them there during the virus as well. We're adding to those numbers because there are some specific logistics tasks and other tasks where their skill set is absolutely perfect, and we're very grateful that the Prime Minister has said yes. We've still got, I think, a request was made some time ago. We're just working our way through getting more than 100, I think from memory it's more than 100 clinical staff. There are many here now, but we're adding to that. I had a discussion with the Prime Minister about that this morning. Sometimes these requests are lodged. It does take a few days to be able to stand up the sort of capacity that you need. But again, I wouldn't want anyone to suggest that we're not in complete partnership with the Commonwealth, because if they did, they'd be wrong. That would simply be wrong.
Do you have any problem, if it's required, to have ADF personnel on the ground around the towers if the police come to you and say, we can't continue this going?
Well, that's not the position that the police have put to me. Again, any requests they made to me would be given the seriousness that they absolutely deserve. I would look at that matter. Again, as I said, I'm not so fussed about the uniform people wear. It's about getting the job done. Having said that, though, there is a very practical issue. a member of the ADF is not a member of Victorian law enforcement and do not, as a function of Victorian law, have the ability to do the work that police and PSOs do. So that's a pretty significant thing. Wherever anyone from whether it be from another state or from the Commonwealth, wherever they can help us in this challenge, then we will ask for that help. And if it's offered without a request, we'll be more than happy to take it.
Have you been comfortable with the level of compliance with people in those locked down suburbs over the past few days?
To tell you the truth, I haven't got a report today based on police activity overnight. I'll get that later on during the day. But look, I understand that it's very challenging to be in those suburbs at the moment. But every single Victorian benefits from that. Most notably those communities where we know the virus is at unacceptably high levels, those lockdown postcodes. I just want to be very clear with people that these are very challenging numbers. This is not the position that we wanted to get to, but all of us have got a part to play in getting control of this virus, stabilising it, driving down case numbers, containing it, and then getting back to a point where we can resume our program of opening up. That will be further away if people don't do the right thing. That will be further away still if people say, oh, well, I want this to be over, so I'm going to pretend that it is. It isn't. There's a long way to run in this. And where we are now shows you that even a small number of cases, particularly if those cases coincide with people not following the rules, large family groups where people are ill, going and visiting other large family groups and so on, you can finish up with many hundreds and indeed thousands of cases as a direct result of that. This is serious, this is real, and no Victorian has any excuse but to take this seriously. Otherwise, we will finish up in a situation where all postcodes are locked down. No one wants that, and no one through their actions and the choices they make should make that more likely, should contribute to that outcome, should deliver that outcome. That is not what we want. I know it's difficult. I know people are sick and tired and fatigued of this global pandemic, the rules, the restrictions. I get that, I understand that. But this is where we're at. There is no vaccine. It's wildly infectious. If people pretend it's over, all they'll be doing is spreading the virus. And then we will finish up with even more rules that'll be even less palatable. We've all got to stay the course. We all have to do that. And it isn't too much to ask that people just use common sense and good judgment. It is real, it is serious, it's not over. And I just ask all Victorians, I can't do this on my own. A team of thousands of Victorians can't do it on their own. I need each of you to do the right thing. Otherwise, everyone is going to be back in their home in a lockdown. That's what's going to happen. This could not be more serious. Could not be more serious. I'm not telling people what to do. I'm asking, work with me and my team, and we will get this back under control, and we will be able to resume our easing, our opening up. The alternative is people pretend it's over, and it'll be anything but over if some of that behaviour continues.
Premier, you said last week you set full responsibility for working with government. Your judicial review later this year finds serious failings of the government response to how you handle this crisis. Will you resign?
Well, I think your question doesn't make a great deal of sense, with the greatest of respect. You've already indicated that the judicial inquiry won't be reporting for months. So why don't we all just wait for that judicial inquiry to report, lest I spend all my time up here answering every hypothetical question that you might be interested in.
Professor Sutton said he hadn't heard of anyone refusing a test in the towers. Has it been reported to you?
No, it hasn't, Nick. Those who've been asked for a test, as far as I know, those who've been asked for a test have been part of that program. That'll obviously ramp right up today, and we'll be able to provide you probably a more detailed report tomorrow. I just don't think there's any reason for people not to consent to a test in those towers. There's no, in fact, anywhere for that matter. It's not too much to ask to be tested, so that your results can be used to protect you, your family, and indeed every single Victorian family. That is not too much to ask. For some, It is a challenging process to go through. That's why the saliva test can be used for those little kids, for instance. We always try and do as best we can to make it as easy a process as it can be, but the results are very, very powerful. And look, to those residents, if anyone who doesn't get tested, obviously the rules that apply to all residents now will have to continue to apply for them, potentially after the hard lockdown has ended. We would have to assume, as I said yesterday, that those residents were positive, and therefore the most precautionary, the hardest set of restrictions would have to remain in place for them. I don't want to get to that. I want everyone tested so that we've got real data, not theories, we've got actual data, and then we can make the best decisions that both protect public health but also understand that this is a very challenging thing, a very, very challenging thing for people to be confined in their homes. I think we will make decisions about that once we've got a fuller picture around testing. Obviously, someone who tests positive, all residents, and that's the basic reason why all residents are in their own unit and are not able to go out for the 4 reasons. They're not able to mingle as they would normally do. That's the reason for the hard lockdown. We know it's in there. We've got to get the testing completed and we have to be as precautionary as possible. And that is to say, anyone who is positive, and indeed every single resident, is in their home, in their flat, in their unit. We're bringing support to them. Certainly those who have tested positive will not be able to leave their premises, their dwelling, at any point. There'll be a permit system that's operated similar to other states, and on that basis, I'll leave Gladys Berejiklian to speak to that. I think she'll be up soon. Certainly around lunchtime, to give people just a sense, and that's why there is some notice, just because there'll be a whole lot of practical things that people need to work through. Sorry? Yeah, of course. We wouldn't want to upset that. There'll be different permit systems that support both border communities, but also there'll be some other very significant commercial activity, freight things, as you note. I'll just take people back to those stay-at-home orders that have people in their homes but 4 reasons to leave. There is an acknowledgement that where it's low risk, we should always try and facilitate as much normal activity as we can, unless you get into a really high-risk environment, which would be, say, an individual house in any suburb where people had tested positive or were close contacts, or indeed the 9 towers that are in that harder lockdown, because to do anything else would be an unacceptable risk.
So Victorians had a holiday plan in New South Wales for lockdown post-COVID, they cancelled the holiday.
The border will be closed, and going on holiday will not be an acceptable reason.
And does the border being closed mean that if you do go into New South Wales, you must have 2 weeks of quarantine, or is it just you can't go?
I will leave it to Gladys to take you through the details. It is closed. It's being enforced by them. This is obviously an issue of Victorians moving out rather than the other way, so that her requirements and the framework that she's going to put in is really a matter for her. And I don't think it'll be very long. I think she'll be out quite soon to take people through that. And if there's any questions that she doesn't have answers for right now, then I'm sure she'll be happy to come back to people.
We had law enforcement coming from another quarantine hotel, the Holiday Inn, the security guards still not using PPE. How can it be that that's still ongoing now?
Well, again, I'd leave it to perhaps come back to you later on to follow up on that. That's not a matter that's been drawn to my attention. People are very clear about the absolute requirements that are on them. Every member of the team, regardless of contractual arrangements, regardless of the uniform they wear, everyone needs to be focused on that. I believe they are, but I'm more than happy to have someone come back to you on the specifics of that. Just in conclusion, can I again say I am so grateful to all of those who are making enormous sacrifices, those who are on the front line of our fight against this virus. We'll continue to support you, and all of us who aren't living in lockdown postcodes, all of us should be sending not only our best wishes, but following the rules in order to thank those who are in much more restricted circumstances than the rest of our state. It's not too much to ask that someone take a test. It's not too much to ask that people use common sense and good judgment And for some, stop pretending this is over. It is not over. It is far from over. And I appeal to you, if you want that to be the case, if you want to be on the other side of this, with more opening up and less impact on your life, then we've all got to work together. We've all got to get tested when we're sick, and we've all got to follow the rules. Thanks very much.